Hello family, today let's talk about the role of ultrasound in screening for cervical cancer. First of all, let's talk about some of the few symptoms of cervical cancer. It could range from low abdominal pains, it could go to bleeding during sexual intercourse, it could go to the lower back pain. And why do we do ultrasound for when we are screening for cancer, for cervical cancer? What we do is we do a scan called a pelvic scan or a transvaginal scan. And what do we want to look at? We want to look at the cervical region. We want to look at the cervix, just to make sure there are no masses, there is no cystic or solid mass lesions that are seen. Even if they're there, we also want to look at these masses. We want to characterize them. We want to make sure, we want to look at them. We want to make sure are they simple, are they complex masses? If they're cystic or solid mass lesion, are they complex or are they simple? We want to look at the thickness of the cervix. Is it thickened? We want to look at, is there any signs of inflammation? We want to look at the calcification. Are we able to detect any calcification within the cervical canal? We also want to go to the uterus, the lower uterine segment. Are we able to pick any fluid in the uterine cavity? Are we able to pick any fluid around the uterus? We also want to look at the inguinal region around the iliac fossa. We want to look at those regions, make sure they're normal, just to make sure there are no nodes which are enlarged, there are no swollen nodes, there is no lymphadenopathy which can be seen around that region. So once you go for cervical cancer screening and you are told to do a pelvic scan, this is some of the information that you are looking for. I know during cancer screening, cervical cancer screening, there are other procedures that people do. This pap smear, but once you do pap smear, you will be advised to do an ultrasound scan, and this is the reason why we'll do this scanning. So once you are told to do this, kindly go for it. Once again, I've always said ultrasound is a very simple procedure, but it can give us so much information, so it can give us so much regarding some of these issues. Because if there's malignancy, if there's any pathology, if there's any disease, we are able to pick it up as early as possible, so that at least we can plan on treatment. And once again, I've said, once cancer is detected early, the prognosis, the treatment process, it's very positive. The results for the prognosis, it's very good as compared to when we detect it or when we pick it late in stages. So let's go for these procedures. Let's go and do these the pelvic scans. Once you are told to do it, kindly go for it, because the information that we can pick from these scans, I'm sure that it can be of help. Once you get this information, kindly share it, because I know I've always said information is power. Once you receive this information, I'm sure somebody somewhere can be helped. And what I can only say is, thank you for always tuning in. Thank you for hearing just tuning in and hearing what I say. And I'm looking forward to speak to you on my next topic. What I can say is, if there's anything that you want me to talk about, kindly drop a comment. I will be willing just to look at it and see if I can speak about it, just to see if I can talk about it. Thank you for tuning in, and just have a great day ahead.